Well, this week is Perinatal Mental Health Week, aimed at raising awareness and destigmatising perinatal mental health issues. It refers to the period of time when a woman becomes pregnant and up to a year after giving birth. Across Australia, up to 100,000 families are impacted every year. Joining me now live is the CEO of Peach Tree Perinatal Wellness, Vivianne Kissane. Vivianne, thank you so much for joining us this afternoon. Look, people may not have heard of this, so tell us about what some parents experience during this perinatal period.
Thanks for having me. So perinatal mental health is basically the umbrella term that includes any mental health experiences that happen during that period of time of preconception, pregnancy, giving birth, and that postnatal period. So postnatal depression and anxiety is probably the most common that is well known, but we know that this is also something that can happen antenatally, and there are other experiences such as post-traumatic stress disorder from birth trauma and postnatal psychosis. And people can really experience these things on a continuum from being very mild or actually to become quite life-threatening. It is what we call a vulnerable period of life. There are many contributing factors that we know can impact our emotional health and well-being during this time. So it's really important that we've concentrated this week at really sending a message out there to know that if this is something that you are experiencing, you're not alone, and there are some really great services out there wanting to help.
Look, it's such an important conversation to have. Just on that, what are some of the contributing factors?
Look, it's a very unique and individual experience. For example, some people might have to have their babies through IVF or have fertility issues, grief and loss through to miscarriage and stillbirth. Survivors of domestic and family violence or sexual assault usually experience a lot of struggle around here. And we know there's issues like alcohol and other drug and substance use and misuse issues, and also suicidal ideation and a lot of suicidal thoughts and intrusive thoughts that can happen. And it's actually quite a myth that people who are experiencing perinatal mental health concerns want to harm their baby, because it's not always necessarily the case. And so we know that there are a range of different things that people can experience, and it's really important just to, be familiar with the signs and symptoms, educate yourself around what they are and how to identify them. And if they are things that start to happen for longer than a period of 2 weeks, we really encourage people to speak up and reach out and get some help, and whether that's from, another family member or a friend or someone else in your mother's group, or a health professional or your GP, or maybe your child or health nurse or midwife.
Absolutely. We know, Vivianne, during COVID, many new parents in particular, they were isolated, they couldn't see anyone with a newborn. Has that exacerbated the problem in your view?
Yeah, absolutely. And I still think we're yet to see the full impact of how COVID has impacted parents who have given birth during that COVID period. We know that isolation and loneliness is a really big contributing factor to our emotional health and well-being, and a lot of parents struggled through that. So that's actually one of the reasons why this Perinatal Mental Health Week, our theme is Uncover Your Village, because it really is important that expecting parents and new parents really put those supports and find their village before these things start to get really hard and struggle, and put those, that framework around you so that you're not alone through this struggle.
And then just take us through finally, what support is available for people who feel like they may be going through this themselves?
Look, the great news is there are now lots of parenting organisations and lots of mental health organisations out there for support. If you jump on our website for Perinatal Mental Health Week, we've actually got a support tool finder on the website where people can actually go in and have a search around what services are available in their local area. And there is actually quite a varying range from government services to as well as community-based services. And, reaching out and talking to other parents, in your community, and really finding different things and different avenues of support. And sometimes your village, you need to think a little bit outside the box as what that might look like as well. So it might not just be a mother's group, it might be a meal subscription service, it might be an online service, so really, exploring and reaching out and finding out what's out there.